Hello students, I'm Dr. Srupti and I will be giving a lecture on basal cell carcinoma. So the topic for today is the basal cell carcinoma. As you know, this is the basal cell carcinoma is the skin cancer. So it is one of the most common skin cancer. So the number one category in the skin cancer is of the basal cell carcinoma, followed by basal cell carcinoma, followed by SCC, and then followed by malignant melanoma. This basal cell carcinoma arises from follicular epithelium. Arises from the follicular epithelium. It is a locally aggressive tumor. It is slow growing and very metastasized. And if it is recognized at an early stage if it is recognized, then the treatment is possible. And the treatment is local excision. Okay. So when this BCC are multiple, then they are associated with one of the syndrome which is called as a nevoid BCC syndrome or the Gordon syndrome. So nevoid BCC syndrome or the Gordon syndrome, we will have multiple BCC. Before age of 20 years, plus various disorders are associated with it, like medulloblastoma, ovarian fibroma, and the odontogenic keratocyst. In this, there is the mutation of the PTCH gene. So this is again one of the exam questions that BCC is associated with this type of, when they are multiple, then they are associated with syndrome, that is the nevoid BCC syndrome, which is also called as the Gordon syndrome. So you have to mark it as Q so that it's an exam question. Now we come to the pathogenesis. So what happens is basically in the normal cell, when we talk about a normal cell, this PTCH plus SMO forms a complex while binding with the SSH. Okay. And it leads to the gene expression and the normal growth. That is normal growth. But what happens in this is in BCC, what happens in BCC, this SSH is not there. So there is the PTCH and there is the unregulated proliferation of the SMO. This SMO is highly active and it leads to the unregulated proliferation and finally unregulated growth and hence forming BCC. So what happens basically, there is the mutation in this PTCH gene which leads to the active proliferation of the SMO. Okay. So when you talk about this BCC, there is the problem in this Hedgehog signaling pathway. Again, when you were asked about the pathogenesis, so there is the mutation of PTCA gene, there's the mutation of SMO gene, and it leads to the BCC. Okay. So now we move on to next. That is the clinical features. What happens is basically it is more common in the fair skinned people, then more frequent in the middle age, more common in the sun exposed sites like head region is greater than the trunk region. And how the lesions express themselves, they are basically pearly papules with dilated vessels. And this advanced lesions, they may ulcerate and invade to the basically to the bones and to the facial sinuses, forming a so-called rodent ulcer. Again, an exam question. Okay. And this basically is more common with the nodular variant of BCC. So what you will be getting in a BCC is basically a polypeptide lesion with the dilated vessels. That will be the clinical presentation. And if that is an advanced lesion, it will be ulcerated lesion, which will be going towards the bone and the facial sinuses. And hence it is called as the rodent ulcer, as the ulcer is getting going to the invading the other, like a rodent, like mouse and all. These all comes in the category of the rodents. Okay. Now, histologically, what we will get in the BCC, there are 4 points which you will get histologically. So one is the basaloid cells. Second is the stromal retraction. Fourth is the tumor palisading. And the clefts or the separation artifact. So these 4 points basically are in the favor of we will be seeing as we will be going for the diagnosis of the BCC. So these basaloid cell nests are basically nothing. These are derived from the, suppose this is the epidermis. So these basal cells are derived from the basal layer of the epidermis. You understanding? So these are derived from the basal layers and hence called as the basaloid cells. So these basaloid cells are actually, these cells are highly hyperchromatic. Well, they will be more blue in color. And these cells are basophilic, hyperchromatic basophilic cells. Okay. These 4 points are basically we take into consideration for the diagnosis of the BCC. So now I will be telling you how you will be defining them. So suppose we get, this is our epidermis. Okay. These are the basal cells. Then from these basal cells, these basaloid cells will form, these basal cells will form a nest. Like any type of a nest, they will form. So this is called as the basaloid cell nest. As I told you, these cells will be hyperchromatic. Okay. Now what you will see is basically a thin layer of separation between these two, like this. This is called as the separation artifact. or the clefts. This will be the stroma, fibrous stroma. Fibrous stroma, which will show retraction. And another thing is that these cells, baseloid cells, are basically perpendicular to the arranged radially, and they are at the periphery of the tumor cells, and they are arranged parallel to the stroma and parallel to each other. These cells are parallel to each other, perpendicular to the stroma cells, and parallel to each other, and hence called as the tumor palisade. So we have 4 points which will be converting, that is the baseloid cell nest, stromal retraction, separation artifacts of clefts, and tumor palisade, which we will encounter in the diagnosis of the BCC. Okay. The differential diagnosis is the trichoepithelioma. And there are various variants. One is the nodular, adenoid, micronodular, okay, infiltrative. But the most important is basically, which has got the good prognosis and less local recurrence, is the nodular variant. Now IHC will be CKAE1, AE3, BER, EP4, which will be 100% positive in the case of BCC. So BCC is basically, if it is diagnosed early, the local resection is possible and it has got a good prognosis. The worst prognosis among the skin cancers is of the malignant melanoma, but BCC is one of the cancer which can be cured. Okay, so what type of surgery we do in BCC is the named as the Mohs microglandular surgery. So hope you will be able to solve all the MCQs related to BCC. And moreover, this is basically, I have given you the form of like a class which you need to know, and the rest of the slides I will be giving you followed. I will be giving you. Hope this topic is clear to you. And if any questions, you can we can discuss in next class, or we can like. You can mail me if you want, and I can clear your doubts. Thank you. Ma'am, I'm done.
Hello. Am I audible?
Hello, ma'am. Yes, ma'am, I'm done.
Okay. Okay, ma'am. So okay, yeah.